Okay, I'm Allie Hunsaker. I'm going to be doing the anterior and posterior load and shift test. So this is a test for glenohumeral instability. So what we're going to do is we're going to find the humeral head here. We're going to load it, and then we're going to shift anterior and posterior. And a positive test is laxity or just movement greater than 25%. And we're going to test this one bilaterally. So we're going to come to the other side and do the same thing. Okay, this is the apprehension test. We're going to put their arm like this. This is a test for instability anteriorly. We're going to do external rotation of the arm, and a positive test is just going to be apprehension from the patient. Okay, this is the posterior apprehension test. We're testing for instability again, posteriorly. We're going to put the arm like this so we can apply an axial load, and a positive test is going to be apprehension once again. This is the sulcus sign test. Once again, we're testing for instability. So what we're going to do is we're going to pull down on the arm right here, and we're looking for dimpling or divoting up here for the positive test.
Alright, I'm Kirsten Banks, and we're going to start with the shear test. So for this test, you're going to find the spine of the scapula and also the clavicle, and you're going to just go ahead and push them together like this. And for a positive test, there'll be laxity or pain, and this is for the AC joint. Okay, and because this is a test for laxity, we're going to go ahead and do it on both sides. So we'll go ahead and do it on this side, find the spine of the scapula and the clavicle, and push it together. Alright, so this is the sternoclavicular joint integrity test, and for this test, you're just going to go along their clavicle. You're going to find where it connects with the sternum, and you'll go about 1 inch from there, and you'll push down on the clavicle, and a positive test would be laxity, so we're going to test both sides and see if it's positive, and then this would be an indication of an SC joint sprain. Okay, so for the drop arm test, you're going to go ahead and have their arm be out at 90 degrees, and you're going to ask the patient, when you let go of the arm, to go ahead and put it down slowly and controllably. A positive test would be that they would be in pain or they wouldn't be able to control the movement, and this is for the rotator cuff. So go ahead and go down slowly and controlled. Okay, so this is the empty can test. A positive test would be weakness, and this is for the supraspinatus. So what you're going to go ahead and do is take both of their arms, have it at 45 degrees, and then flip their arms down, so they're flipping the can down. And then you're going to go ahead and put your arms here and have them resist against your arms. So I'm going to push down, and he's going to push up.
I'm Kyler Norris, and we're going to start off with doing the infraspinatus strength test. So for this test, we're testing for weakness of infraspinatus. We'll have him bring his arm to 90 degrees here. I'll place my hand just right on the other side of his and just have him resist it. And then to test strength, we're going to do it bilaterally. Do the same thing here, and then have him resist it. Alright, so we're going to be doing the speeds test. The pathology for this test is the long head of the biceps brachii, and a positive test is going to be weakness. So we're going to have our patient extend his arms in front of him here, and he's going to resist my movement here, and there we go. Okay, so we're going to be doing the pectoralis major contractor test. The pathology for this test is a tight pectoralis major. So we're going to have him bring his arms behind his head and interlock the fingers. And a positive test would be if the elbows did not touch the table, but they do, so it's a negative test.
I'm Andrew Richardson. Today we're going to be doing the Hawkins-Kennedy test. This test for impingement in the shoulder. A positive test is going to be pain, so we're going to have them flex the shoulder with the elbow at 90 degrees and then do internal rotation. And if that was painful, that'd be a positive test, but this is negative. Now we're going to do the crane test. This test is for a possible labral tear. We're going to be looking for pain and a possible painful click. To do the test, we're going to have their arm at 160 degrees. We're going to load the joint, and then we're going to rotate the shoulder. And you'd listen for a click or pain, but this is a negative test. Now we're going to do the compression rotation test, which is also a test for a labral tear. To perform the test, we're going to have them put their arm at 90 degrees, and then we're going to rotate the shoulder with the joint loaded. If there's pain or a painful click, it would be a positive test, but this is a negative test.